Great. All right, I'm going to go ahead and share my screen. Take a minute to, oops. There we go. Oh no, I can't see everybody. Okay, well, good morning, and thank you for joining this first session of the day. It's a pleasure to be with you. I'm Amy Robbins, and I'm the Director of Advocacy at PHI, and I'm joined with Cathy Rowe. Cathy, you just introduced yourself, but would you like to introduce yourself again?
Yeah, I'm the Executive Director of New Jersey Advocates for Aging Well, and we are now partnering with PHI on this very important effort on the direct care workforce.
Yeah. So what we're going to do is I'm going to do a quick run through of kind of laying the groundwork of the direct care workforce, who they are in New Jersey, and some of the challenges inherent in this workforce. And then Cathy is going to provide some highlights of an initiative, a coalition-based initiative that is currently underway in the state to try to address those challenges. So I'm going to try to go through this relatively quickly. I'm happy to answer any questions in greater depth about the workforce, either offline or perhaps as we get into the opportunity to talk to each other a little bit more.
And Amy,
yeah.
would you just put it on slideshow so the slides appear larger?
Oh, it appears very large on my end. I thought it was on slideshow.
Yeah.
It's on slideshow on my end.
Oh, okay.
That's not working for everybody? It's too small?
No, we see it, but we also see the other parts, but it's fine.
Oh, you do? Okay. Sorry. I see a big slide.
Yeah.
Okay, I'm going to keep going. So the first question, who are New Jersey's direct care workforce? So when we're talking about the direct care workforce, we're talking about really four primary occupations: home health aides, nurse aides, direct support professionals, and then self-directed employees. A lot of those job titles will probably be familiar to you. They work across the spectrum of long-term care, in nursing homes, in private homes, in community-based settings, and they provide the services and supports that elders and people with disabilities need to be able to live fulfilling, healthy lives. So the direct care workforce is rapidly growing. This graphic does not correspond directly to the numbers that are over to the right. So that's really the place to focus to look at these numbers. You can see that the home health aide, that's the CHHA list there, has grown by 45% between 2010 and 2020. And while the CNA workforce has dropped off a little bit, that's really due to the shift in demand for care in home and community-based settings. People are wanting to move out of nursing homes and live in their own homes or in their communities.
Sorry, Amy.
Yeah,
we're still seeing the orange one. The slides didn't progress for us.
Oh no. Okay, but I'm sharing my screen.
There we go.
That's better.
Now we see the three primary factors.
Sorry,
so you can just go back one, no problem.
Yeah. So I just want to make sure everybody has a chance to look at those statistics. The upshot of that is that this is a high growth workforce, and it's primarily in the home and community-based settings. All right, so three primary factors contribute to the rising demand. It won't be any surprise to this group that there is a growing population of older adults in our country, and certainly in New Jersey, and that is driving the bulk of the demand. You know, as I just mentioned, consumer preferences for care in the home. And then there's a lot of policy and programmatic changes happening that are driving the demand for this workforce. So really briefly, what are the challenges? Why is it hard to find these workers and fill the need for these services? So these are some statistics that are updated just recently by us. They come from our our workforce data center. And as you can see, wages were about $15.31 in 2021, and there's a jump from 2010. But just to note that these occupations often compete with similar low barrier to entry occupations like janitors, retail salespersons, customer service representatives, and their average wage in 2021 was $18.53. So it's about a 20% wage differential there. 1 in 4 works part-time. You can see the low wages then drive really economic instability for this workforce. 34% live in or near poverty. A lot depend on some form of public assistance to be able to get by. And really housing instability is a tremendous concern, particularly in a state like New Jersey. And yet, from 2018 to 2028, we're going to add more direct care jobs than any other single occupation in New Jersey. That is the crux of the challenge. Again, high demand, low pay, and so we need some innovative solutions. And now, Cathy, I'm going to turn it over to you to talk about the Essential Jobs, Essential Care initiative that we are working on in New Jersey.
Yeah. So about 6 months ago, PHI reached out to us to bring this initiative to New Jersey. You've done it in 5 other states now. 4 other states, we're the 5th.
4. Yeah.
And recognizing the shifting demographics in New Jersey, recognizing the growth and the increased need, especially after COVID. I think with COVID, we saw the importance of the need. We saw a lot of people leave the field, and we've seen shortages throughout the state. So with a growing older population, we know that the need is going to increase as at the same time as people have started to leave the field under COVID. So if you go to the next slide there. So PHI has developed the Essential Jobs, Essential Care program, in which we're pulling together a coalition throughout the state for people that represent every aspect of the care community, whether it's the people who help and work with the disabled community, working in facilities for long-term care, working in home and community-based services, whether it's private pay, Medicare, or Medicaid. We need to have everybody together talking about this, finding solutions instead of doing our New Jersey thing, which is splintering up into silos. Because if one gets further ahead at the expense of another, we are never going to make the progress that we need. So our first effort in this is going to be to really build up the advocacy related to the direct care workforce, look at the policies that are in place, look at the policies that need to be in place, and we can move forward together. We also want to build the stakeholder collaboration so we're not competing against each other. I mean, at this point, the direct care workers are a limited resource. So we don't want to compete against and fight each other. We want to work together so that everybody wins. We are the 5th state to enter this after Michigan, New Mexico, New York, and North Carolina. Each of them has taken a different approach, and we don't know yet what approach we're going to take, but using the roadmap is a tool that PHI has developed. We feel that we can get there in a very organized and efficient fashion. Next slide. So the 3 main policy issues that we will be looking at are 1, lifting workers out of poverty. This has never been a field that pays well. And a lot of that is dictated by the Medicaid reimbursement. If that doesn't go up, the wages will not go up. Medicaid is the largest payer or provider of the services that this workforce delivers. We also have to invest in workforce innovations. We have to modernize it. We need to make it easier for people to connect with clients, to find where they're needed, to find the best jobs around. We need to bring this out of, you know, a paper and telephone era into an online and a modern era with new tools and new connections. And we also need to get better data to strengthen the workforce. One of the big issues here is the data in healthcare follows the payer. And since Medicaid pays so much of this, we can get Medicaid data. We can get some Medicare data, but we really don't have access to all the private pay. Since it's not coming from one source, we would have to reach out to every single home care agency in the state to get data. And that's realistically not going to happen. Plus all the people that hired directly. So again, we have this reliable Medicaid data, but that doesn't really give us the full picture of who is working in this field and what the needs are in the field. Now on to the next slide. So we started this in May. We had our first convening of stakeholders to start talking about the needs and the priorities in New Jersey. And now we've boiled it down to 3 committees that we're going to move forward with. And they're going to be data, they're going to be the workforce, which involves recruiting, educating, training, and job quality. So all of those are interconnected, and also state policy. So there are 2 sides to state policy. One is, of course, setting good policy that works for everyone going forward. But what the members of our first convening realized was there's state policy that kind of gets in the way, where this is spread out over multiple divisions and departments in the state. So if you're getting certified, or if you want to change your license, it can be a very complicated process. So we want to look at ways to simplify it, to break down barriers, to make sure that the different departments and silos within the state agencies are actually talking to each other, so that we can make this process much easier and much more efficient. So that it was just very interesting that when we brought up policy, thinking policy, new policy, there was a lot of discussion about the existing policy and where it wasn't working or where it was kind of clogging the wheels. Our timeline for this is we started this last February, and we plan to finish this by early 2024. So if any of you are interested in joining us, we are still looking for members for the coalition. We have set up committees. If you're interested in joining one of those committees, please let me know. Or if you just want to be part of the coalition, we'll be reporting back, and we welcome your feedback. There are so many different settings and angles and priorities in here that we really want to make sure that this is something that's going to work for everyone. We're not leaving anybody out. And you can help us, develop this roadmap, which is going to take us forward and hopefully set the stage for meeting the needs of New Jersey in the next 10, 20 years. As we see, we're going to see our population shift, and we're going to see the increased demand. Our goal here is to be really ready to meet it in a fair way, in a just way that works both for the patients and works for the people who are serving them and the workers. And Amy, I probably left a lot out, so you can go back and fill in everything I missed.
You did great, Cathy. I'm gonna stop sharing my screen so we can see who's in the room. And we have about 15 minutes for conversation and dialogue. If folks want to weigh in with a question, I'm just looking to see in our chat if we have any specific questions here, which I don't see. So if anybody has a question, please use the raise hand function. Since we're a big enough group, that would be helpful. Anything to respond to?
Or the first question? Maria, I know you must have questions.
I have one. It's just wondering, it's not really a question. Is there anything that can be done in the short term?
That is a good question. I'm going to let Amy answer too, but I feel like in the short term, at this point, we are still recovering from COVID, and there's a scramble to find enough workers. And that's where a lot of places are. We're hearing from home care agencies that can't find enough people to serve people who are aging in place in their homes. We also know that inpatient facilities are short-staffed and have to alter what they're doing. So for example, reports of people not getting the therapeutic services they need during their stay, or not getting it every day. Some of them getting it at 8 o'clock at night because of just scheduling. So we are starting to see the impacts of the shortage. So that's I think the top priority right now.
And I would just say, I mean, I think, in my mind, the biggest challenge for this field is to provide a competitive wage, right? I mean, we have, workforce shortages across the spectrum, right? Restaurants are short-staffed, Target is short-staffed, everywhere you go, right? And I think a starting point to draw people into this field is really to look at wage parity. And there's a number of states that are taking action to bring the floor of direct care wages up, looking at them in a few different ways. Michigan has used ARPA, the American Rescue Plan Act funds, to increase the wage of their direct care workforce, and then they were able to build that into their budget the following year, so it actually codified that increase. Other states are looking at 150% of minimum wage bills to really try to get that wage to a livable level. But to me, that is the biggest challenge, and something that I think, 5 minutes remaining. This time does go by fast. I think really being creative and looking at what other states are doing around that wage competitiveness issue is going to be the most important place to start. It's a complicated question, so your short-term question is really important. Like, how fast can we make an impact and really draw people into these jobs?
And how much of this workforce is unionized?
That's a good question.
I don't know in New Jersey. I don't think it's a high percentage, Cathy.
No, I don't. And that's one of the data points we have to get. So in the coalition, we have the New Jersey Business and Industry Association, and hopefully they can find some of that. I think part of that depends on where you work. If you're working in a hospital setting or a long-term care setting, you're more likely to be unionized. If you're doing it for an individual agency, and it's so broken up. And this is, I don't know if you stop the recording for this, but basically the wage increase, it's going to happen one way or the other. Just, if it's not, Medicaid is driving the wage right now, not just New Jersey, but most states. If it doesn't catch up through Medicaid or health payers, just send it to the free market. People will pay more out of pocket to have the care they need. One way or the other, the wage will go up. So can we do it in an organized, fair, timely fashion? Or do we want it to just go crazy and go to the highest bidder, which isn't going to work for anyone? We need people to think of this as a career with a decent wage, with benefits, a real career that they're committed to. The way the wages have been kept so low, it looks like we're not taking it seriously. I mean, if you could go get a job at Target for the same wage as actually providing care for someone in their home, a lot of people would go for that easier Target job. But we need to make this a priority, that we say this is a priority. We need to actually treat it as a priority and change that wage and bring it up and take it, show the respect and the seriousness of a situation and of the work that they do.
Yeah, Colleen, hi.
Hi. I was wondering, has there been any discussion in New Jersey about trying to form, direct care workforce worker cooperatives where the workers, have some ownership in the business themselves? And also, what about some policies to create incentives for this workforce, like affordable housing, transportation subsidies, or childcare subsidies, or something to make this a more attractive job to some?
Yeah. So there have actually been a couple of co-ops that I've heard about, and I do need to get more information on, which actually is a really good solution for people who have been in the field a long time and themselves are aging out. If you were doing this when you were 40, by the time you're 60, you might not be able to help lift someone off the couch or lift them out of the car. So the workers themselves are eventually going to be limited in what they can do, some of them. So there are at least 2 cooperatives, and I'm gonna track them down and get more information. But in that, the experienced workers become the owners and also the trainers of the younger generation and the newer ones. So it's a very, very promising model. What was your second part of that question?
Well, the other things that I've heard that if the state or local communities could offer affordable housing, transportation subsidies or childcare subsidies to the workers as an inducement to work in these roles.
Those are some things that came up in our first convening with some like 1-by-1 examples where a long-term care or skilled nursing facility in way out northwest New Jersey, I can't remember where, was offering workers they could stay over for a shift. Like they could do their shift, sleep over, do the next day shift if they weren't able to drive or help with transportation. Another thing that happened under COVID was the Medicaid transportation option. I think it's called Logisticare, where they usually take the patient to the doctor. Under COVID, they were taking the health aid to the patient. That discontinued a few months ago, but that was a good model that we want to bring up again. One way or the other, the patient has to be connected to the caregiver. And, does it matter who's in the car going in which direction?
I want to just jump in. We have like seconds left and just say that compensation, starts with the wage, but what you're talking about are the benefits and really creating a robust package of supports for workers. And I think that's something as we explore compensation further in our coalition